Hello, I'm Dr. Roberto Carricchio. I'm the chief of the Division of Rheumatology at UMass Chan Medical School in Worcester, Massachusetts. And I'm also the director of the Lupus Center at UMass Chan. I'm joined today by Miss Ruth Wilson, who's a patient with lupus, but it's much more than that. She's also a very strong advocate at the national level with a number of foundations, and also the director of our lupus support group in our center. Ruth, welcome.
Thank you so much for having me, and thank you so much for that very gracious introduction. I really appreciate your invitation to be here today.
I'd introduced you as a patient, but you are much more than a patient. You are a very strong advocate for yourself and also for many, many more patients, being part of a very, very active at the national level with a variety of organizations, and also in our local level with our support group. And so, what would be your advice for patients to advocate for themselves, things that you're very good at, and not just for themselves, but also for others in the same situation?
So, I wasn't always a big advocate, and I can understand when a patient gets newly diagnosed, there's a little bit of shame that comes with sharing that you have lupus, right? So it took me probably like 3 or 4 years before I actually started speaking openly about my disease. But I found out that by speaking about my disease, it was really healing for me, and it made me feel like I was making an impact on other people's lives, because sometimes when you share your story, that inspires somebody else to also share their story, and you learn from each other. But I think my top advice for patients navigating the complexities of lupus is to become their own advocates, educate themselves about the disease, the symptoms, and all of the available treatment options, right? And then just communicate openly and assertively with your healthcare team. Ask questions and express like your concerns. And keeping those detailed records of your symptoms, your medications, your appointments, it's going to help you facilitate and have informed discussions with your providers. I think becoming an active participant in your healthcare journey is so important, and your voice matters. You are the person living with this disease, right? You are the expert. Your doctors are obviously, they went to school for this, but you are the expert because you are living with the disease every day. I remember I went to give a talk at Harvard University and thinking, what are they going to learn from me, right? Like, these are Harvard doctors. But when I was giving the talk, at the end of the talk, all these doctors were like, asking questions, raising their hands. And to me, they were questions that were, very common. Like, to me, they were like common sense, right? But then I had to think like, okay, they know what lupus looks like in a textbook, or the experiences that they've had with their patients, but they don't know everything. And so that just kind of gave me like it empowered me to speak more about it, because I was like, if I can educate these doctors, then they can provide better healthcare, better care for their patients, because they learned something from me. So I think just making sure like that you speak up, because your voice really, really does matter.
Yes, I totally agree. Speaking of which, meaning we don't have a cure for lupus, and many patients do not respond to treatments, at least the current treatments that we have. And many patients also do not respond to treatments when it comes to lupus nephritis. They have to go from one treatment to another, and yet they still don't respond, and it's a significant fraction. What do you think is the role then of clinical trials for patients in terms of advocating for themselves? Because when one treatment doesn't work and we have nothing else, would that also be a way to advocate for themselves?
Absolutely. I am a big advocate for clinical trials. Again, this should be part of, I feel like clinical trials should be part of a patient's standard of care. I wish it was, right? But as part of this sort of awakening and educating yourself in lupus, you should learn about all of the clinical trials that are out there and, talk to your healthcare provider. Hey, I saw this clinical trial that I might be eligible for. Can we try this, right? Especially if the treatment that you're on already isn't working. I would most definitely, I always advocate for participating in clinical trials, not only because you're going to get even better care, right? You're going into the clinic all the time. They're checking on you. You're getting to try this drug that nobody else gets to have. And, and then whatever they learn from you, from the study, is going to help so many other people that are going through the same thing that you are going through. So I think that's so important.
Thank you. Yes, we definitely we need more treatments to have patients with controlled diseases, because we still have a long way. We went a long way, but as someone who's looking at or taking care of lupus patients for 3 decades now, I've seen a big change, but I hope that in the next 2 decades I'll see even more change, because we still need more.
Mm-hmm.
So, well, this was quite an enlightening conversation. You shared a lot about your disease, but even more about your approach, and really fruitful and great insights for all the patients that are going to listen to these messages.
And I just want to say these 3 last things, to the lupus patients. One is that, you're not alone. You need to reach out for support from loved ones, from support groups, from your healthcare professionals, from the lupus communities. Definitely join a support group and lean on them for advice. You are stronger than you know. And each challenge that you face is an opportunity to grow and thrive. The second thing is empower yourself, right? Always educate yourself about lupus, about clinical studies, about your needs, and actively participate in your treatment decisions, right? And then the last thing is embrace self-care. Prioritize your physical and emotional well-being. Practice self-compassion, and celebrate your resilience in the face of adversity. This is a very devastating disease, and you need to treat yourself with kindness and gentleness, because you are deserving of love and acceptance, just as anyone else. Thank you so much for having me. This was a very useful information, that I hope helps other lupus patients. So thank you so much for having me.
Thank you, and let's thank also the audience that has joined us today to listen to us, and especially to your story. Thank you very much.